I don't know why, but I've been noticing a pattern lately of people who really don't know very much about therapy coming on the internet and speaking ill of it and basically discouraging people from seeking therapy.
I think the worst thing that you could do is go to therapy. Most of these people seem to be absolute basket cases, like to the worst degree. That is not a line of work that you get into by being like a normal and well-adjusted person.
So today I'm going to be reacting to this video because I think it's actually pretty dangerous messaging. Okay, so first let me just play you the full video and then I will sort of break it down piece by piece.
If you're a well-adjusted person who's going through some like passing anxiety or grief or sadness or whatever, I think the worst thing that you could do is go to therapy. I'll put a caveat on this. I think a good case for therapy is if you're a narcissist, you can actually just pay $300 to go in, tell them your half of the story, and then they'll tell you that everyone else in your life is bad and gaslighting you and you're the good person. That is a good, that if that's what you want, that would work really well. Okay, but now to the main point. A lot of therapists have started posting more on social media in the last couple of years to like market themselves, which is a good idea. But what's immediately observable to the savvy eye is most of these people seem to be absolute basket cases, like to the worst degree, and they're probably carrying more baggage than you are. That is not a line of work that you get into by being like a normal and well-adjusted person. You get there by having been like neurotic and insane growing up. And to think that whatever like line of thinking or whatever happened that got them into this line of work is also not going to seep into the advice that they are giving you to apply to your own life, very naive. Why would you ever take advice from somebody whose life is worse than yours or like totally average? You shouldn't. And it's kind of sociopathic to a degree where they seem to think they know everything. They're going to impart all of this wisdom on you. But now that we can see their social medias and you see what their own life looks like, you're kind of like, wow, like you are wholly unqualified to like impart any information on this situation. And I get it though. Like you can be in a funk. You don't know what to do. So you're like, I'll try therapy. I hate to break it to you, but if you're dealing with like an inexplicable like sadness or anxiety, you might need to look at the way that you're living. The human brain is a very finely tuned machine, okay? And feeling like grief or anxiety are very natural reactions to like environmental stressors and conditions around you. In that sense, even like a good therapist can be kind of counterproductive because you're coming up with all of this like mental exercise, all of this work to try and like not focus on or numb whatever it is stressing you out instead of just addressing your problem. It's really incredible the amount of people I know who are like going to therapy routinely and then they get out of a relationship or move cities or take a different job and immediately all of this like mental exercise, oh, you need to be practicing it all goes out the window. They don't need it anymore at all. So yeah, I don't know, man. If you're in a funk, I take a DNA test, figure out your ancestry, go on Wikipedia, look at what they were doing there 800 years ago, and then optimize your entire life towards that. You're going to be fine.
Okay, first of all, it's pretty dangerous to tell people to stay away from therapy, which has been shown through evidence to be effective for treating mental illness. I don't know if this is not general knowledge, but the way that evidence-based treatment works is you select a population, like let's say people with major depressive disorder, and then you do randomized control trials to see if a specific type of therapy is effective for that specific population, tested against a control group, a placebo group, or some other type of treatment that maybe we already know is effective to sort of pin them against each other. That type of research, that entire body of literature to show us that something is actually effective for treating different mental struggles doesn't happen with other types of treatment like femininity coaching, whatever the fuck that is, or other types of pseudoscience. Or as we'll talk about in a second, this guy's own mental health advice, which I think is even worse than femininity coaching. Again, also like coming out swinging, saying like, oh, therapy is great if you're a narcissist, you just want to have everything you say validated. We've been over this already already. There was an entire video I made about somebody who made a similar claim on TikTok. That's not how it works. I don't know where people get this impression that that's all therapy is. Certainly there are some therapists that lean too much in validation and support, but overall, again, therapists are trained in evidence-based treatment, different modalities that involve a lot more than just validation. I don't know if this impression is maybe from people who are misusing therapy speak, who haven't even gone to therapy, or maybe, somebody's girlfriend just left them and started using therapeutic words, who knows. But next, let's address the most egregious claim of this TikTok, which is that therapists are certified basket cases. Because not only does this sow distrust in the field of therapy, this is also the exact type of stigma that harms people with emotional and mental issues. But listen, with any type of healthcare provider, you could get somebody who helps you or someone who harms you. Like, I've told this story before, but I'm going to keep telling it. There was one time I had a contact break in my eye, and I went to the eye doctor, and he was incredibly dismissing and honestly misogynistic in some of the things that he was saying. And he was like, no, if a contact lens broke in your eye, you would be in so much pain. He didn't ask me how much pain I was in. I found the piece of the contact lens in my eye like a week later, and really bad things could have happened if I hadn't caught it. Now that I'm older and better at advocating for myself, I know that there are options out there. There are clinicians out there who truly take their patients seriously. And if you're looking for a place to find such clinicians, one place you could go is MIDI Health, who are kindly sponsoring this portion of the video. MIDI is a virtual clinic built to truly see, hear, understand, and help women through the best clinical practices. They offer virtual care for issues like mood and memory, skin and hair, longevity, weight, menopause and perimenopause. They can order lab tests, do advanced screenings, prescribe skincare like tretinoin. During visits, you can review your results together and make a treatment plan for whatever issue you have going on. And there are no memberships or hidden fees. MIDI bills insurance just like any healthcare provider would. So if you want to schedule a virtual visit, go to trymidi.com/DRANA and join the over 200,000 women who love and trust MIDI Health. And remember, they accept insurance. Okay, so let's address this claim that like most therapists are absolute basket cases. How are we still stigmatizing mental illness like this in the big year of 2026? Do some therapists go into the field of therapy to solve their own issues? Yes, of course. It's common for people in all healthcare fields to go into a certain specialty either because they themselves have struggled with that thing or somebody they love has struggled with that thing. We can recognize that there's nothing inherently wrong with someone becoming a neurologist because their mom had a stroke at 12, right? Or becoming a cardiologist because they themselves had an early heart attack. So how would it sound to say, ooh, you became an oncologist because you had cancer? Yikes, what a basket case. I'm going to be staying away from you. It would sound incredibly moronic. But for some reason, we stigmatize mental illness in particular, where we view people with mental illness as bad in various ways, as immoral. And that emboldens people like this guy to make it seem like having a mental struggle means you're someone that shouldn't be listened to, who doesn't have anything valuable to say, who can't be competent at their job. And you also have to remember that a lot of people who become certified basket cases, as he so endearingly put it, usually got this way because they experienced really fucking hard things. Pretty much all mental illnesses, with the exception of maybe like neurodevelopmental disorders or heavily biological disorders, are primarily triggered by trauma. That's how epigenetics works. You have maybe a predisposition to something and then a trauma unlocks it. Are we then meant to dismiss those people who have gone through really hard things and be like, nah, you're just crazy, you're a basket case? Do you think that's a particularly kind thing to do? But also, it's not even true that all or even most therapists go into the field of therapy because they themselves need psychological help. A lot of people are just really caring and want to help others who are struggling. I was curious what the research had to say about this, so I took a look at it. Apparently, mental illness rates among therapists are inconsistent. Some studies show similar rates to the general populations, some show a slightly higher rate, and some even show a slightly lower rate. Those trained in therapy are, of course, more likely to seek help, to be attuned if something's not working for them emotionally. So a higher rate wouldn't even necessarily reflect that therapists are more mentally ill than the general population, but rather that they're more likely to be proactive about their mental health. Something else that I discovered is that therapists have crazy high rates of burnout and suicidal ideation. And apparently a lot of healthcare workers experience higher SI rates. Physicians, like I know dentists in particular, have a really high rate of attempted So this guy is honestly just such a jerk for stigmatizing a group of people whose mental health suffers in large part due to the burden that they take on trying to help other people who are suffering. Like, you have to remember that multiple therapists have already been murdered by their clients in the year 2026. Therapists take on a huge risk, a huge amount of liability simply because they're that motivated to want to help other people who are struggling. So framing therapists who are just trying to help those that society generally wants to shun as batshit people who shouldn't be trusted is such playground bully behavior. His argument basically is most therapists are crazy and therefore they're unable to help you because then they can't give you good advice. None of those things are true. Most therapists are not crazy. We don't even have evidence that they have higher rates of mental illness than the general population. Even if someone does have mental struggles, that doesn't mean they're not competent at their job, because therapy is not giving life advice. I don't know why it's always the people that have never actually been to therapy themselves that have the most shit to talk about it, because if you'd ever been to therapy, you would understand the point of it is not to give life advice. Therapists give you the tools to help yourself. They don't tell you what to do with your life. So even if they were basket cases whose own lives were a mess, that's not necessarily going to affect the evidence-based treatment that they've been trained to give to you. Also, remember that therapists are supervised for a really long time before they practice independently, and most of them, even after they get licensed, still have things like consult groups or maybe even individual supervision. If there's some sort of issue like countertransference, like maybe something that you're bringing into therapy they're struggling to deal with and sort of like regulate their own feelings about, most of them are going to have places where they can process through that professionally, or places where other therapists can bring it to their attention so that they can repair what's going on. Now, there is some truth to the notion that therapists on social media are revealing more about themselves right now, and I think this is true about all people and all careers, which might mean that, yeah, it's more readily available if they're not a great fit for certain types of people, or in some situations might mean that they're, actually embarrassing themselves. There are definitely unhealed therapists out there, just like there are some physicians who struggle with their physical health. You know, like there are therapists in like these Facebook therapist groups who are always getting into arguments with each other, being like really reactive, where you can tell they're not actually practicing any of the emotion regulation that they teach to their clients. There are therapists who they themselves would avoid therapy like the fucking plague. Unfortunately, I have known one or two people like this myself who wanted to be therapists to other people, but were so incredibly avoidant of going into therapy themselves because there were things they were trying to avoid from their personal life, from their past. And because of that, inadvertently, their unresolved issues were impacting their professional standards. But would you devalue a physician just because he has a cigarette addiction or struggles with his weight? I would hope not, because even if someone's just struggling to put into action something that they themselves preach, doesn't mean they're not still preaching the right things, or that they're not highly competent and trained to help other people achieve those things. You don't know what's going on in that particular person's life. It's true that therapists with unhealed issues can cause harm to their clients, but that's true of anyone. A physician who doesn't listen to clients, who yells when they get questioned, who gets defensive with them, like the one I talked about who didn't believe me that I had a contact stuck in my eye, they're also going to cause harm. Everyone is capable of causing harm, and that's not a product of having mental illness. I'd argue that therapists, even if they had or have mental illness, are actually more likely to be healed from it because they know the scientific literature, what helps with certain issues. They probably went to therapy themselves. They have all the tools at their disposal to get better. So then at the end, this guy says something about how if you have some sort of transient sadness or anxiety in your life, it's probably mainly environmental, meaning your lifestyle. Can it sometimes be environmental? Absolutely. I can tell you that a lot of my anxiety that I struggled with up until a couple years ago dissolved when I simply switched careers and moved location. And therapy helps you identify some of the environmental factors that might be contributing to your mental struggles that you can take ownership of in order to hopefully get better. A lot of anti-therapy people will say, just eat healthy, go outside, do some exercise. Those are also components of various forms of therapy, like DBT, that teaches you to emotionally regulate by doing things like that we know are healthy for you. But we also have heritability studies showing that most mental illnesses are around half genetic in their etiology, and some are actually much more than that, like neurodevelopmental disorders such as ADHD. So it's not all environmental. If you are struggling with something, just changing your lifestyle is not always enough. But his tip there that just figure out your ancestry and see how people in your ethnic group were living ages ago, this is genuinely one of the most bizarre pieces of mental health advice that I've heard. Hello, naturalistic fallacy. Just because something something is natural or something that we were doing thousands of years ago doesn't mean it's good or something we should be doing now. Our ancestors were living in a completely different environment where other things were required to keep us alive and healthy than today. You know, like eating in excess was adaptive back then because typically it was hard to find food, whereas today, where we have food in abundance, it's not as healthy for us. And back then, we also had a much shorter lifespan. It didn't matter that we were maybe going to die at 65 of heart disease because of eating too much meat. If we were going to die at age 45 anyway because a neighboring tribe was going to come and kill us, so for now, we just needed to be strong and have muscle. And lastly, you know, anytime somebody really fears therapy or therapists, it makes me wonder what that person is running away from. You know, like when I was still a therapist and I would like get into an Uber and the Uber driver would ask me like, what do you do? And I would tell them what I do. A lot of them would react really weirdly. They would say like, oh, can you tell what I'm thinking? Or don't read my mind now. Or are you psychoanalyzing me right now? And it was like, honestly, if I wasn't before, I am now. Because what are you trying to avoid about your own psyche? What is so scary to you about introspecting or about someone truly seeing you, someone who is trained to see you maybe in ways that you don't even have awareness of yet? Personally, that's what I always think when people are like fear-mongering about therapy is like, I wonder if you're psychologically hiding from something and you're kind of projecting that onto the rest of the world. And like, while I can understand psychological avoidance is a problem for people and not something that needs to necessarily be pathologized, I think when you get to a point where you're getting in front of a camera and encouraging millions of people to not go to therapy and to instead just live however they were living thousands of years ago, that's where you're crossing into the territory of like, you should really face whatever you're going through. What did you think about this TikTok? Let me know down in the comments and I'll see you soon.
Tell me what you mean, 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 tell me.